Hello, the next part of our week one introduction is a discussion of the ANA Code of Ethics. There is a link on your topic outline that'll take you to the ANA website where the Code of Ethics is displayed. They won't let us download it. There you have to purchase it, but I just wanted to show you where you would go to look at that without costs. And the ANA Code of Ethics guides us in our advocacy and our ethical journey in nursing. I'm not going to read these one by one to you, but I want you to read them. The provisions that we will most closely deal with this semester is Provision 3. The nurse promotes, advocates for, and protects the rights, health, and safety of the patient. And Provision 8, which is what the case study is on, the nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. Now, Provision 9 is also dealing with shaping policy, but it says the profession of nursing, the profession, not the nurse, as represented by associations and their members, is responsible for articulating nursing values, for maintaining the integrity of the profession and its practice, and for shaping social policy. So there is 4 main guiding principles, and I think this is probably discussed in every nurse program, but we're just going to review them quickly. Autonomy, meaning the patient has the right to make their own decisions. Beneficence means that we are going to do the best. We are always going to try to do good for the patient. Justice means we treat all equally and that everyone has access to the care that we provide. And non-malfeasance is that do no harm thing that we learn about, where you make sure that the things that you do are not going to harm your patient. Now, Provision 8, it says the nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. Think about what that means to you. And there is it's not a long case study. It's just a little blurb of a case study to prompt you to thinking what you're going to respond in the discussion board, which this has prompts related to that case study, which is an item in the folder for this week. I believe it's down below all of the videos and their related PDFs. So think about that, and then I'll be adding my thoughts in this week on your entries to the discussion board. But thinking it's a difficult road to hoe, as they say, or road to hoe, because we live in such a cost-centric world. Healthcare is so expensive now, and trying to use our position as nurses to try to make sure that human rights are upheld and that health disparities are reduced is a very important thing. You do it in little ways, I'm sure, in your practice, and you're not even aware of, because it's such a part of who nurses are, making sure people get the best care we can possibly give them, no matter who they are. But we just see the patient. Okay. Next goes into the employer policies on political advocacy. I'm going to put these together in one video instead of having 2 separates, because I think I can get them not to be so long that you're dying when when listening to the audio here. So there are things that guide employers into making decisions on how much we can indulge in political advocacy while we're working. Remember, we always have to follow the policies and procedure of the organization where we work. The number one thing is respecting patient privacy. If we're going to be doing advocacy, we can't be sharing information or using patients' experiences without proper authorization. We can't violate HIPAA, and even more than HIPAA, our own ethical framework. We can't, no matter how great the cause, we can never allow the cause to impinge on the patient's privacy. Personal time versus work time. They may clarify this distinction to what you do on your own time is fine, but when you are working and on duty at the hospitals, that you have to be careful. You have to work within the policies of the hospital. The hospital shouldn't be able to tell you what you can do as a private citizen, but they may want to ensure that patient care is not compromised or privacy. And that's why you need to be really careful. And we're going to talk about this later in the semester in the technology and nursing advocacy week and policy week. We need to be careful what we post, that because you think you are hiding the person's, you've changed enough that you're hiding the person's identity, but somebody could look at that and know, and you can't take that chance. Compliance with laws and regulations. We always need to comply with the hospital policies where we work, because that is where our practice and standards of practice are driven from. And of course, we need to be compliant with local, state, and federal laws and regulations governing politics, political activities, lobbying, and campaign contributions. We can't when you have a patient as a captured audience, you can't just start talking to them about something and try to get them to donate to a cause, because they can't go anywhere because they are stuck in the hospital with you taking care of them. So we need to make sure that we follow laws. And conversely, the hospital needs to make sure that they aren't trying to get you to advocate for or donate to a political campaign. They can't coerce you to do that as part of your employment. How is you as a nurse can engage in public policy? First, collaborate with interprofessional teams. That we get things done the most effectively when we work together. You can write op-eds or opinion pieces for newspapers or articles. There are usually advocacy days at the state capitol or elsewhere where you can go to advocate for laws and experiences that will improve healthcare or patient care or the nursing profession. Utilizing social media and online platforms, but making sure you do those in a manner that is professional, ethical, and does not break patient confidentiality. Pursuing a leadership position, just becoming a BSN, that will increase your capability of getting higher leadership positions in your organization, so you have a more impact on the policies of the organization and what's happening in the organization. And usually when you are in a leadership position, you might be asked to be part of a board or an external organization. And there is a big push right now with the ANA to get nurses on the boards of companies, because a lot of physicians are on boards. That gives them political power, and to make the changes they want for their profession, we need to imbue, especially when you think of healthcare organizations, healthcare associations, or causes in the community. Getting on those boards is how we will impact where the political advocacy is headed. And then supporting legislation, especially when, if you belong to the ANA or the ONA, they will send out like news briefs about laws that are coming up for review in the state legislature, and they ask you to write your congressperson or state senator, and that might be your in the federal level also. They might want you to write your federal congressman or senator to help to get those legislations, those laws that we want to have passed as a profession, because we want to improve care and we want to improve our profession and the safety of nurses, to get those things passed. So thank you for your time. Call me if you have any questions. Don't call me. You can call me, but it's more effective if you email me, and I will try to answer you as quickly as possible. If you need to talk to me, if you email me, as I said in the orientation video, I will make it work to get a time when we can meet to talk about these things. So thank you, and have a great week, and stay warm. Hopefully we won't get any more snow, and you have a great day.